Benign prostatic hyperplasia is often called BPH, or an enlarged prostate. BPH is common as men get older. It is not prostate cancer. Still, it can cause frustrating urinary symptoms. BPH is one of the most common prostate problems. Experts estimate BPH affects about 5% of men aged 40 to 64. For men 65 and older, it's around 32%. Medicare can help with prevention, diagnosis, treatment, recovery, and medications. Before we get into BPH coverage, it helps to look at what Medicare covers overall. Part A covers medically necessary inpatient hospital stays and skilled nursing facility care. It also covers hospice and some home health services. Part B includes doctor visits, preventive services, durable medical equipment, and outpatient care. Part D generally covers prescription drugs you get from a pharmacy. Medicare A, B, C, and D can include coinsurance, copays, and deductibles. In this video, we'll walk through BPH prevention, diagnosis, treatment, recovery, and medications. Medicare does not have a standard BPH screening benefit. Medicare Part B covers most preventive services, including a yearly wellness visit. Those visits may support an enlarged prostate prevention plan. Medicare Part B also covers a yearly prostate cancer screening for eligible men aged 50 and older. This may include a prostate-specific antigen blood test and digital rectal exam. To diagnose BPH, doctors usually talk to patients about their urinary symptoms. They may ask when symptoms started, review medications, and hydration habits. Medical tests can include urine tests, blood tests for kidney function, and a PSA test. Prostate screening can confirm an enlarged prostate. Urine retention and flow are assessed by some diagnostic tests. Medicare Part B covers many diagnostic tests, doctor visits, and outpatient care, subject to a deductible and 20% coinsurance. A urology visit may be covered when medically necessary. Medications, surgery, and minimally invasive procedures are available for BPH treatment. Most medically necessary surgeries are covered by Medicare, including transurethral resection or incision of the prostate, electrovaporization, green light laser treatment, and aquablation. Some newer procedures may have extra Medicare rules depending on where you live. Medicare coverage for inpatient stays begins after you meet the Part A deductible. The Part A deductible applies per benefit period, not just once each year. Recovery depends on the treatment used. Part B covers outpatient follow-up checks that may be needed for symptom improvement and medication side effects. Post-procedure recovery involves catheter care, activity limits, follow-ups, and monitoring for infection, bleeding, or urinary retention. A recovery support facility may be needed after surgery. Part A applies to skilled nursing facilities when certain criteria are met. Skilled nursing care typically requires a 3-day inpatient hospital stay first. Medications can relax prostate and bladder muscles. Common BPH medicines may include alpha blockers, 5-alpha reductase inhibitors, tadalafil in selected cases, or medications for bladder frequency. Prescription drug coverage varies by plan rules, tiers, formulary, and pharmacy network. A formulary is a drug list covered by your Part D plan. A drug may require prior authorization, step therapy, and quantity limits. Part B often covers drugs given in medical settings. In most cases, this involves drugs given via injection or infusion, and vaccines for prevention. With Medicare Advantage, additional rules come into play. All plans must include Medicare services. However, the guidelines can change. Network use, referrals, and prior authorization may affect access. Medicare Advantage plan rules can also affect costs and timing. Benign prostatic hyperplasia is a common and treatable condition. It is not prostate cancer, but urinary symptoms should still be checked. Coverage depends on medical need and plan rules. Understand the symptoms, identify the cause, and verify coverage. Always confirm coverage with Medicare, your doctors, and your plan.